Assalamu alaikum. My name is Dr. Mohammed Hasan and I'll show you how to examine the elbow joint. First, and before any examination, we should wash our hand. After that, we greet the patient and introduce ourselves. After that, we should explain what we're gonna do and obtain the consent from the patient. السلام عليكم.
وعليكم
أنا دكتور محمد حسن الطبيب المسؤول عن حالتك الصحية. أريد أسوي لك فحص كامل للمفصل المرفق. تسمح لي؟ Generally speaking, we have 3 steps in the examination of any joint. These are to look, to feel, and to move the joints. The first step in the examination is to look to the joint. We start looking to the joint by checking the carrying angle of the joint. After that, we look for any joint deformity or joint swelling or joint rash. After that, we check for any rheumatoid nodule around the joint and in the proximal extensor surface of the joint. تقدر تقول هذا؟ زين كيف تسويها؟ The second step in the examination is to feel the joint. After palpating any joint, we should ask about pain. If there is any pain, we should not examine the joint. If there is no pain, we can start palpating the joint. We start palpating by feeling the lateral epicondyle and medial epicondyle and olecranon process, and also any tendons in the area. The third step in the examination of the elbow joint is the movement, whether actively or passively. There are 4 principal movements. These are flexion, extension, supination, and pronation. سردك ايش تسوي لي؟ ترفع ايدك. ايش تسوي؟ ايش تسوي؟ تمام. نزل ايدك هيجي. ايدك هاي رخيها. There are 2 special tests in the examination of elbow joint. The first one is tennis elbow joint to detect the lateral epicondylitis. To test the elbow joint for tennis elbow, support the patient's elbow by your hand and flex the elbow joint at 90 degrees and supinate the elbow joint. Then passively extend the wrist joint. If the pain develops at lateral epicondylitis, then the test is positive. The second special test in elbow joint examination is golfer's elbow test. This test is used to detect medial epicondylitis. To examine the elbow joint for medial epicondylitis, support the patient elbow with your hand. Ask the patient to flex his elbow joint at 90 degrees and ask him to pronate the hand and resist the extension of the wrist. If the pain developed after that, so the test is positive. ادفع مفصل الرسغ لفوق باتجاه ايدي. صار عندك ألم؟ لا. ادفع لفوق. صار عندك ألم؟ لا.